When people talk about Margaret Sanger, the conversation often jumps quickly to controversy. Names become headlines, and headlines become arguments. But history usually lives in the quieter spaces between those arguments, in the details of what was actually proposed, what was actually done, and what actually happened afterward. One of those quieter, yet highly debated chapters is something called the Negro Project, launched in the late 1930s. To understand its purpose, you have to picture the United States at that time. The Great Depression had strained families across the country, but in many black communities, especially in the rural South, the strain was even heavier. Access to doctors was limited, maternal death rates were high, and reliable medical information was scarce. Birth control itself was still controversial, and in many places, legally restricted. Into this landscape came a proposal: expand access to voluntary family planning education and contraceptive information in underserved black communities. On paper, the stated purpose sounded like public health. The plan involved working with black physicians, nurses, and ministers. The idea was that trusted community figures would be the ones communicating the information, not outsiders delivering lectures from a distance. Supporters at the time described it as an attempt to give women knowledge and options they often did not have. But purpose and perception are not always twins. Sometimes they are distant cousins who only meet at family reunions and argue over dinner. Margaret Sanger's known involvement with the eugenics movement complicated how the Negro Project was viewed then and how it is remembered now. Eugenics, broadly speaking, was the belief that society could be improved by influencing who had children and who did not. Many reformers of that era, across political and academic lines, flirted with or openly supported these ideas. Today, those beliefs are widely rejected because of how they fed discrimination and human rights abuses. Knowing that Sanger had engaged with eugenic thinkers makes people look back at the Negro Project with sharper questions. Was it purely about health and autonomy, or was it shaped by the biases of its time? The outcome of the Negro Project was less dramatic than the debates that followed it decades later. It did not transform the nation overnight, nor did it lead to sweeping demographic shifts. In practical terms, it resulted in limited outreach efforts, educational materials, and partnerships with local leaders. Its scale was modest. There was no massive infrastructure, no nationwide mandate, no sweeping enforcement. It was, in effect, a targeted initiative that operated within the constraints and controversies of its era. Yet its symbolic impact grew larger over time. Why? Because history does not just record events, it also records associations. When later generations examined Sanger's writings, her alliances, and the broader presence of eugenic thinking in early 20th century reform circles, the Negro Project became a focal point. For some observers, it looked like evidence of troubling intent. For others, it appeared as a flawed but sincere public health effort shaped by the imperfect language and assumptions of its day. And that is where the intrigue lives, not in secret documents or cinematic revelations, but in interpretation. The same archival letters and program outlines can lead two readers to entirely different conclusions. One sees empowerment mixed with paternalism. Another sees medical outreach tangled in the social hierarchies of its time. Both are looking at the same ink on the same paper, but through different lenses polished by modern values. In the end, the Negro Project tells us less about a single hidden motive and more about how reform efforts can carry multiple layers at once. It shows how initiatives can be intended as helpful, influenced by prevailing ideologies, limited in execution, and later transformed into symbols far larger than their original scope. History here behaves less like a verdict and more like an echoing room. The words spoken decades ago continue to bounce off the walls, and each generation hears them with slightly different ears.